Good morning, ladies and gentlemen. My name is Rossella Miccio, and I'm the president of Emergency, an international NGO that was established in Italy back in 1994. And today I have the pleasure and the honor to share with you our activities during the first wave of the COVID outbreak. We are very glad that it has been selected among the 100 solutions for peace to be shared during this 2020 Paris Peace Forum. What we did basically, we tried to prevent, protect and inform the communities that we were working, as we are an NGO dealing mainly with health issues. Briefly, what Emergency is, it is an international NGO that was established in Italy with the aim of providing free and high standard surgical and medical care to the victims of war, landmines and poverty. And by doing that, we also hope to promote a culture of peace, solidarity, and respect for human rights. Over the world, we have been working in approximately 20 countries and treated over 11 million people worldwide. The principles that have been the basis for our work since the very beginning are the fundamental principles embodied in the Universal Declaration of Human Rights by the first, where it's clearly stated that all human beings are born free and equal in dignity and rights. And it's exactly the recognition of this inherent dignity and of the equal and inalienable rights of all the members of the human families that is the foundation of freedom, justice and peace in the world. Therefore, we believe that by practicing on a daily basis the right to healthcare, we can contribute to build a more peaceful, just and inclusive world. Currently, actually, when the outbreak hit the world, we were running programs in several countries: Afghanistan, Iraq, Sierra Leone, Sudan, and Italy. And all our activities were ranging from war surgery to obstetrics and gynecology, trauma surgery, physical rehabilitation and social reintegration, up to cardiac surgery and cardiology, pediatrics, and primary health care, particularly in Italy. We also have other programs that were about to start in Uganda and Yemen, but they had to be put on hold because of the outbreak. What we're going to do today, I will take 20 minutes, not more than that, to go through our governance model, the actions that we implemented, the beneficiaries and the impact of these actions, and then we will try to look at the future, particularly when it comes to the developments that we hope will come out of this Paris Peace Forum. And then I will leave 10 minutes at the end for your question, and if there is any. So our governance model, Emergency is a medium-sized NGO. We have a very agile governance model with a board of directors of approximately 20 members that has elected among its members an executive committee with the aim of making sure that the priorities decided by the board are implemented in our daily activities. And for this COVID outbreak, we immediately reacted since mid-February and established a COVID response team that was led by myself and by the director of the field operations. Why we reacted immediately? Because working in many countries, we were fully aware of the potential impact of an outbreak that had its source in China, but could really rapidly spread around the world, particularly in the countries in Africa and in the Middle East that have a lot of relationship with China, but at the same time, a very weak health system. Therefore, we immediately activated all our different departments and started to reshape our activities and even establish new programs, both in the field of hospitals, primary healthcare, vulnerable groups, and also psychological support, involving a wide range of different stakeholders, going from local communities to volunteers, municipalities, but also regional authorities, ministries of health, and international bodies such as the WHO. The aim of our action was to prevent contagion, to protect our hospitals and health facilities, but not just to respond to the need, but also to empower the communities and the partners that we were working with. And we applied this vision to our projects worldwide that were already running, but also to new specific activities in response to the COVID-19, particularly in Italy. What we did around the world, well, starting from our hospitals, as I said, our major concern was to make sure that they could continue to provide the fundamental health services that were badly needed in those contexts. So immediately we reviewed our policies and guidelines in terms of infection prevention and control, in terms of patients and staff flows, and also in terms of PPE, so protection equipment needed to make sure that staff and patients were protected. Therefore, we, since mid-February, supplied all our facilities worldwide with the necessary PPE and drugs and consumables that could guarantee a smooth running of the clinical activities, even in a situation of a lockdown, as the one that then actually occurred. On the left-hand side here, you can see our waiting area of the pediatric outpatient clinic in Mayo, which is on the outskirts of Khartoum, and it's an area, a former IDP camp, an area inhabited by approximately 300,000 people, where our pediatric clinic is the only free of charge health facility for the children of the area. On the right hand side, you can see our rehabilitation center in Iraq that has been producing continuously, even during the first wave of the outbreak, 2 to 3 prostheses per day to the victims of the many wars that have been raging in the area. Here you can see other examples, particularly these pictures are taken from Afghanistan. On the left-hand side, there is one of our first aid posts. We have approximately 40 first aid posts and primary healthcare centers, mainly located in remote area, those that are heavily hit by the conflict, by the ongoing conflict. And on the right-hand side, the hospital in Lashkargah, that is one of the 2 hospitals for war victims that we have in Afghanistan. One thing that I would like really to stress here is that over the past few months, and even now, we are rightly so very much concerned about the effects of COVID-19 outbreak. So we're trying to deal with this specific disease, but we cannot forget that all the other disease, particularly war, is still ongoing. Wars never stopped during the outbreaks. The Secretary General of the United Nations called several times for a ceasefire, but his call was unheard. And as we can witness, many people, particularly civilians, 90% of the victims of current wars are civilians, have been caught in the crossfire and hit and wounded and maimed and killed. Therefore, for us, it was absolutely fundamental to be able to guarantee these services in a safe way for the patients and for the staff in those areas. And we are very happy to say that we have been able to do that. And to do that, we had to revise completely the structure and the flows of patient and staff in the hospital, based on the principle of IPC and compartmentalization, so separation of places, people, and tools. We did it for the emergency rooms of our hospitals, and we did it also for the internal wards of our hospitals, where we established new donning and doffing area, increased the number of hand washing stations, reduced slightly the number of beds to make sure that there could be a safe distance among patients for themselves and for the health staff, of course. And then when it comes to Italy, to the new activities that we developed, we were involved around mid-March by the regional authorities and the Italian civil protection in Bergamo. Bergamo is an area not very far from Milan, and that was at the heart of the first wave of the COVID-19 in Italy. We contributed to the design of a specifically built-in field hospital for COVID. And with our team of approximately 50 health specialists, we ran a 12-bed intensive care unit within that facility, and we were in charge of the supervision and implementation of all the IPC measures. And this was a very important example to be put in practice, because we were able to guarantee treatment and at the same time make sure that the staff did not get infected, as this was one of the major problems we faced in Italy during the first wave, that contributed to limit the access to proper healthcare services in our country. But in addition to hospital care, we realized immediately that being such a contagious disease, COVID-19 was a serious threat, particularly for the most vulnerable groups. Therefore, since we work since many years in Italy, also supporting marginalized people, such as homeless, migrants, and accompanied minors, we immediately developed our guidelines and protocols to set up proper COVID-appropriate facilities to host these people, and we implemented that, particularly in Milan, where we, in cooperation, in partnership with the municipalities, supported over 65 shelters that were hosting approximately 2,500 people, as I was saying, migrants, homeless, unaccompanied minors. What we did was basically to supervise all this facility and reorganize them in terms of flows, but in terms also of distribution of within the facilities. And we did training of approximately 400 social workers that were running those facilities. In addition to that, we also provided the health surveillance to these facilities, because one thing was very clear for us. This is one of the most important lessons that I hope we will keep from this outbreak, and is that if we want to be a society and a safe society, we cannot leave anyone behind. We need to take care, particularly of the most vulnerable groups, the most vulnerable individuals, because by taking care of them, we do not only guarantee their right to healthcare, but we also protect our community and make sure that we can overcome whatever kind of emergency, even COVID-19. But since COVID was also was not just a health emergency, but became immediately also a social emergency, because with the lockdown, a lot of people lost their jobs, therefore they could not support anymore their families. We developed since early March, first in Milan and then in several other cities, volunteer service to support those who could not take care of themselves anymore by delivering groceries and basic items. And also, when the lockdown finished, was concluded, we continued and we actually further developed this initiative by providing food items and personal and home hygiene kits to over 15,000 people currently in Italy, in several cities. So all in all, during the first wave, we have supported approximately 316,000 people. As you can see here, most of them were the patients of our hospitals worldwide. We cannot forget that we have been able to continue to deliver life-saving surgery such as cardiac surgery in Sudan, for example, and that hospital was the only hospital open all through the first wave of the outbreak. But at the same time, we have also provided basic support and very important social support to vulnerable groups, approximately 3,000 migrants, homeless, unaccompanied minors, and 13,000 vulnerable people hit by the pandemic. The impact, what I believe is that having been going through this the first wave in a very intense way, I still remember those days where we were continuously trying to discuss among ourselves on how to have a real impact on the beneficiaries, on the situation, on the people that we were trying to look after. I think that this was part of the key of the success of this process, because we were always able to be flexible. So these interventions were continuously rearranged and readapted according to the new information that were shared about the disease, about the virus, because we cannot forget that this is a new virus, so it's something that was not known. So also the scientific knowledge has been developed over the past month, and we try to apply this approach to many different initiatives and replicate it across different sectors, from health to social support to psychological support. In addition to that, we were also able to involve a wide range of partners, of actors, of stakeholders, and this empowered also the marginalized and vulnerable groups. In many of the shelters that we supported, we also did the training of the guests, and some of them became the leaders of their community in terms of preventing the contagion and monitoring the health conditions of their fellows, of the fellow guests. And then the involvement of several stakeholders, both at state level and at international level. For example, we also contributed to the development of the WHO guidelines for COVID communities facilities in low resource settings. This proved to be quite an effective collaboration. For the future, what do we expect? Well, we hope that through the Paris Peace Forum, we can expand the international awareness about our activities and our organization, but particularly about our way of working, our approach, because we believe that it's something valuable that needs to be shared. And by sharing, we mean also strengthening and broadening our network of partners. So we hope that from this experience we can expand the partnerships at international level, and also consolidate our advocacy role, particularly when it comes to public health. We cannot forget that public health is a common good, therefore it has to be protected. Governments and authorities need to allocate appropriate resources, and only in this way we can really build the future for our communities. And we hope, as I was saying, that this participation will also strengthen our possibility to influence the decision makers, particularly when it comes to healthcare. We believe that this model can be scaled up, can involve more actors, and actually this is what is happening now in these days. During this second wave, we are rethinking our intervention and talking to old and new partners in order to develop new activities, because we believe firmly that our approach has the potential to fulfill the right to health, even when confronted with unprecedented challenges, and only if all together we can fulfill this right, we can be sure that we are building a safer and a more peaceful world for everybody. Thank you very much. I would leave the floor now to questions, and if is there any. And I thank you for your attention. And here you can find all our contacts if you need to, if you have any specific information. Okay, so the first question I have is, what aspect of your model do you think are most distinctive or innovative for replication? Thank you very much for this question, an easy one. I think that, what was a key element for our intervention was the flexibility and an open-minded approach. We have, as an organization, a very extensive experience in terms of response to health emergencies. We worked during the Ebola crisis, where we had the only intensive care unit for all the West Africa in Sierra Leone. We have been working with cholera outbreaks, so we work in war settings. Therefore, what we did was basically start from the experience we had, and then try to understand the specific differences of this particular virus and outbreak, because COVID-19 is different from Ebola, particularly in terms of means of contagion, and fortunately also in terms of mortality rate, because it has a much lower mortality rate, but is much more contagious, and the symptoms are more difficult to be immediately detected. Therefore, we try to understand how to protect as much as possible the health workers, and then the beneficiaries and the community at large. And I think that the interaction of many different sectors or skills, health, logistics, technical skills, were the key of our approach. So it was really a common effort done by different specialists that joined together with a common aim to protect and to create awareness. And what we did was also to try always to explain not just what to do and what not to do, but the rationale behind this. So this is and this can be applicable to many different solutions and different sectors and projects. Another one, who are your main partners and where do you get resources to do this impressive work? Thank you very much for the impressive work. Well, we have many different partners, as I was saying, from in Italy. They range from municipalities, local health authorities, and in the countries abroad, usually is the Ministry of Health, but we also work with international organizations, UN, European Union, the WHO, of course. And the resources, well, they come mainly from individuals that are supporting us, fortunately, a lot, but also from foundations, institutional donors, and above all, this is something that we are very proud of. We have been able to involve in the also financial support of our projects, like in Sudan, in Afghanistan, in Sierra Leone, the local government, because they consider those facilities as priority for the country. Therefore, we do sign memorandum of understanding with them, and they also contribute to guarantee a part of the financial resources needed to support these centers and to provide free of charge health services to the population. Another question, could you provide us with a practical example of your intervention model? Well, yes. For example, one thing that we did here in Milan, specifically for this COVID, was not only to monitor the 65 shelters that I mentioned before, but we decided with the municipality to set up a specific facility to make sure to guarantee a proper isolation and health surveillance to the vulnerable people that could not have a safe place where to isolate, where they showed symptoms. Because we cannot forget that the indications were rightly given to stay home, to call a doctor when you have symptoms, and to isolate in case of symptom arises. But if you have no home, if you have no doctor, if you are living in a crowded environment and you cannot isolate, these are just empty words. So in order to make sure that also the most vulnerable people were able to respect and to protect themselves and the community, we set up a completely new structure that was actually a pretty good example, fairly unique in Italy, of a cooperation between an NGO, a local authority that had the focus of protecting the most vulnerable people. How do you hope this edition of the Paris Peace Forum will support your work or your project? Well, we hope that through the Paris Peace Forum, we can be more visible at international level, and we are fully open to share this experience and to partner with other actors and institutions in order to expand and to strengthen these activities. And I hope that through the Paris Peace Forum, this edition of the Paris Peace Forum can be just the beginning of this journey. I think I have only 1 minute left, so I just would like to thank again the Paris Peace Forum for having identified our projects among the 100 solutions for peace. We do believe that really by practicing health as a human right, we can build a peaceful world altogether. Thank you.